Hello everyone, my name is Bridget Stewart and I am the Program Coordinator for the Health and Community Wellness degree here at the University of West Georgia in the College of Education. I welcome everybody to this presentation and I want to talk to you a little bit about the degree, give you a little bit more information about the degree, and talk to you about some of the important events coming up related to Health and Community Wellness degree. First thing you can see on the screen is we have some wonderful full-time and part-time faculty that teach here with us in the department. Ms. Gina Brandenburg, as some of you know, worked with Tanner's Get Healthy, Live Well program for many years. Mary Beth Sloan, Christine Knoll, Jessica Aldridge, and Kimberly Bingham sort of round out our full-time faculty, and we have two wonderful part-time faculty members in Dr. Katie Henley and Dr. Michael Chan Frazier. Now, the mission of the Health and Community Wellness program is really to provide future professionals with a quality education, specifically those individuals that want to work in health promotion and education, fitness, nutrition, specifically in work sites, employee wellness, fitness centers, hospitals, schools, other public health agencies. We are not a healthcare degree. That is the one thing that I want to make sure that we explain, that individuals understand, is that we are not healthcare. We are health promotion and education. So the best way to describe it is we are sort of on the front end of more of the prevention side. We are not on the back end. Once someone needs treatment, surgery, therapy, that's essentially healthcare. We're on the front side trying to educate, trying to behavior change, make changes for individuals when it comes to stress management, fitness, mental emotional wellness, all of those areas. And we are a holistic program, so we don't just focus on the physical wellness. We do focus on social, specifically the social determinants and health disparities of our country and our communities. We do focus on mental and emotional wellness as well. So again, we're sort of on that front side versus that back side, which would be considered health care. Now, our curriculum is 120 hours. So if you're looking at a program sheet, you've got 60 hours on the left-hand side, 60 hours on the right-hand side. Obviously, the core curriculum, we don't have flexibility in changing that. All students take those same courses, but when you get to Area F, you can see that there are some specific courses that are sort of the introduction to the major, and once students have completed those courses, then they move over to the right-hand side of the program sheet, and of course the program sheet can be found on our website. They start their professional content courses. Now, students have to maintain a 2.0 GPA, and then there's also what we call 15 professional elective area, which is on the right-hand side. So what we encourage students to do is to really pick an approved minor, and we're going to talk a little bit about some minors coming up in our department, but to pick an approved minor and focus in that area, or if they know that there are courses, again, 3,000 or 4,000 level courses that they can take in preparation for grad school, then we encourage them to take those courses in that 15 elective hours as well. Now, we do feel that it's important as a faculty to have certifications and additional trainings and professional development built into our program because we do know, speaking to our partners out, our practitioners out in the world of health and community wellness, that a degree is really important, but there are additional professional development content or skill sets that our students need. And so we have built in certifications tied to specific courses that students get a discounted rate to be able to take those national certification exams, so that when they graduate from a health and community wellness program such as ours, that they not only have a degree, but that they also have some credentials to back their name, because our program really focuses on having students go out and start out into the workforce as soon as they graduate. So on the screen you can see that there's specifically ACE. We work a lot. They are an educational partner, so the American Council on Exercise. We work with WellCOA, which is the Wellness Council of America. They're sort of the gold standard for worksite wellness. And so we work with Exercise is Medicine, which we'll talk about here shortly. And so we work with the American Heart Association and all of those national organizations to build in those credentials for our students. Now, we do have what is called a service learning course. This is an entire semester where students tie the course descriptions to their practice out into the work site. And so this is a time where students get to really apply their skills that they're learning in the classroom to a specific project or a specific organization in the community that has a need, and that need has to be reciprocated, obviously, for service learning. So there's a need from the community partner and a need for the student, so that the student has a big portion of the development of the program, the implementation on the program. And as you can see, these are just some of the partners and some of the programs that we have been a part of over the last couple of years here with our service learning project. We also have what is called Exercises Medicine on campus. We have been a gold level partner with them for the last couple of years. But Exercises Medicine on campus is a program through the American College of Sports Medicine, which is calling on universities and colleges to engage in the promotion of physical activity as a vital sign. So essentially, we're looking at trying to get individuals to notice that exercise can be used as a form of medicine versus a pharmaceutical prescription. And so Chrissy Knoll is the advisor of that program, and so we do have a student group that works with her for events on Exercises Medicine on campus. So if you're interested in getting involved with that particular program, please reach out to her. She'll be more than happy to get back with you and to let you know how you can be a part of that particular program. Now, these are some of the professional organizations that our students and our classes that we promote to our students and our classes. And so these are the ones that we feel are the credible organizations. As you know, if you just simply type in health and community wellness organizations into Google, you're going to come up with many ones. And so there's a lot of them that are just sort of out there as a money-making piece. And so we wanted to make sure that our students had evidence-based, that they had credible organizations that they are working with and working for. And so these are some of the ones that our particular program promotes. Now, one of the cool things about our program is that we have tailored our program and our program assessment for health and community wellness around the National Wellness Institute's first ever core competencies for wellness professionals. And so we've never really had a set of national standards or core competencies for wellness professionals. Now, you can certainly find them for health professionals, for those that really wanted to do more with nutrition and fitness, but our program really focuses on how can we get students to look holistically? How can we get them to look at individuals not just from a physical standpoint? And so I have worked and have chaired the National Wellness Institute's Council for Wellness Certification Excellence for the last couple of years. And one of the things that we did as part of that group is we developed the country's first ever set of core competencies for those wellness professionals. And so having said that, we have already implemented these components into our program. Here at the University of West Georgia, we are one, if not the only one, of the universities in the country that has actually started to implement these core competencies. So we feel like it provides an important piece for our students. Now, one of the things that we will be doing, the spring 2018, summer 2018 semesters, we will be working on national accreditation for our program through the National Wellness Institute. Obviously, that has many benefits for our students, but all of our students that graduate from our program with a minimum set GPA to be determined will automatically graduate with certified wellness practitioner credentials, which is a big piece. And so obviously it also gives our students a 5-year membership and it makes them eligible for those credentials for certified wellness practitioner. So we're really excited about that possibility of gaining national accreditation. We would be, I believe, only the 11th program in the country so far with that accreditation. So we're going to work really hard for our students to get that accreditation completed. Now, another thing that we do in our program is we do evaluate our students on their professional dispositions, and we feel it's important that students don't just realize that you don't just come to class and you're sitting there and that's enough. Like, that's really not enough for you to be a professional in health and community wellness. So we evaluate, and we typically go over this in detail in our intro class with our students, their professional disposition. So their attendance, their class preparation, their leaving early, arriving late components, their professional dress, their professional interaction with their faculty and their community partners and their peers. And so professional dispositions is something that we do evaluate our students on typically about mid-semester and the end of the semester to make sure that we're holding our students to a higher standard as a future professional, to uphold the integrity of the program, and to make students understand that there are legal and ethical considerations that they need to take into effect, not just because they're a student, but because they are being prepped as a future professional. Now, we also do have a student organization called SHIFT, Students Helping to Influence, Fulfill, and Transform. So if you're an individual that likes to work on campus and work with other students to be able to promote our program and the values that we think are important, we do have that organization, and it is open to all students. Just a couple of things that I thought were quite interesting for people that are looking at our program to say, well, what kind of jobs can I get with this degree? And you'll see on the screen, and you may even want to pause this narration to be able to look at these in detail, but health educators, community health workers, epidemiologists obviously particularly requires a terminal degree, but dietitians requires individuals to go back and pick up some additional coursework and also take a national test for a registered dietitian, exercise professionals. So you can see that all of these listed on the screen are well above the sort of the national average when it comes to the job market in health and wellness. A couple of others, public health nurse. So sometimes we have nursing students that transfer their major or change their major to health and community wellness, and eventually they go back in to nursing, and they sort of combine the two. So they combine nursing and they combine public health, and they become a public health nurse. And so this is another one that we have a lot of students that are interested in. Health promotion program coordinator would most certainly be one. Health coaching for different organizations versus Coca-Cola and Delta. Worksite wellness programs. These are all fine examples of the different types of jobs that are out there for our specific graduates of our program. Health and wellness manager, again, would be another one that sort of gives you a little bit more information about that one. So just a couple of things as we close out here that are coming up for our specific degree. I mentioned earlier during the spring, summer semesters of 2018, we are going to start work on national accreditation for our program. We also have a space here in the Coliseum, used to be called the Human Performance Lab, that we are now sort of titling the Wolf Wellness Center, and we are moving that program. It's still a space for classrooms, but we are shifting that space a little bit to be sort of a community and faculty and staff outreach, where we'll be doing multiple different testing for faculty and staff, health education for faculty and staff and students. Obviously will be a wonderful space for training for health and community wellness majors as well, but nutrition and personal fitness counseling, wellness coaching opportunities. So we're really looking to make that space a little bit more flexible and to be able to open that up to faculty and staff here at the university, and then ultimately to the underserved population in the community. And of course, future programs, minor in health and community wellness is already approved. We just do not have a specific start date for that program. I would probably guess fall of 2018 would be a good guess on when we could start offering the minor in that specific degree. But then one that's really, really exciting that I think a lot of students, even health and community wellness and across campus, is the minor in nutrition. It's actually titled Minor in Nutrition Promotion and Education. It is underway, and we hope to submit that during the spring of 2018 semester, and hopefully that will start summer or fall of 2018. I also have a couple of other minors in our degree. We have a minor in sport management, so for those health and community wellness majors that want a minor in sport management, and we have a minor in coaching that will be developed. I don't have the specific dates for those yet, but those are 2 additional minors that will be coming your way through our department as well. And so lastly, as we wrap up here, again, I encourage you to email me if you have questions or visit the website. I am always available to meet with students, including their parents, if they are interested in learning a little bit more about the degree and being able to market our degree. And I think we have a wonderful degree here. We have wonderful faculty for our students. So if you have any more questions, please don't hesitate to reach out to me. I'll be happy to help you, and hope you enjoyed the presentation.